Hello, America. Bruce Bongard here, virtual presidential candidate under the Prolution Party. Once again, this event is being sponsored by www.cf2008ontape.ning.com. Question and answers, Section 4, Healthcare Issues. Question number 1, what is your primary healthcare objective or solution? Question number 2, is healthcare in America a privilege, a right, or a responsibility? So to begin, what I'd like to do is first discuss what exactly my objective would be for healthcare. I talk about prolutions, which are progressive solutions, and I believe I've come up with a kind of a happy medium between providing universal healthcare and also a privatized type of approach. I like to call it the share the fair healthcare. And in essence, what it is that all U.S. citizens will pay an annual wellness membership fee to the government, equivalent to a to be determined type of percentage of what I call a personal life bond. Now, that health care, it's a matter of how we perceive health care. In America, we have outpatient health care, plus we have inpatient health care. I believe all outpatient health care should be what would be covered under this annual wellness membership fee. So, for example, let's say that fee that everybody would pay, all U.S. citizens would pay, that would include all immigrants into the U.S. that are now legal immigrants into the U.S. would also be paying this membership fee. So therefore, they're entitled to that level of outpatient type care. So, for example, if you get sick, for just common colds, viruses, that sort of thing, you need to go for a physical, that sort of those sort of healthcare issues. That stuff would all automatically be covered and government sponsored. And so, since it would be government sponsored, there would definitely be an auditing process that would try and reduce those costs for healthcare. Now, what I believe the privatized area should be is for all the inpatient type care, such as long-term care. Let's say you have a major illness, major injury. Those things would all be privatized. Okay, I believe wholeheartedly in competition, and I believe that if we were to reintroduce competition back into our healthcare system, costs would go down. They wouldn't go up. And at the same time, introducing it as a portable type of approach, so that healthcare is now, when you go from one employer to another, you still can maintain your health insurance. It'd be very similar in lines with how car insurance is, that once you go from employer to employer, it's not within the employer system any longer. It's private in that it's a private carrier that would be covering that kind of, that you would be covering that insurance from. So, being private, able to go from job to job, healthcare would be in place, physicals, all, urgent kind of care, that kind of thing would automatically be covered and sponsored by the government aspect of the program. And as I mentioned, government would regularly audit to make sure that the costs would be not exorbitant. I think that's the best approach. It combines both worlds. It combines the universal coverage as well as it combines a privatized insurance-based type approach as well. And in essence, everybody should be able to determine what their level of insurance is that they would want through the private carriers. And nobody would be rejected, and it's completely removing healthcare from the employer-based system, which I believe through competition is actually going to drive up and stimulate a very competitive type of approach for healthcare. Question number 2, is healthcare in America a privilege, a right, or a responsibility? I believe it is both a privilege and a right at the same time. I believe people should have a certain degree of health care, and that's why I'm talking about the wellness membership fee approach, or the wellness membership approach. Question number 3, what are your top 3 health concerns in America? How will you tackle them? I think right off the bat we're talking about cancer, we're talking about stroke, we're talking about diabetes. People in America are on on the heavy side. Let's face it, as a nation, we are bordering on obesity in the United States. And so we have to tackle those, as well as what I call, and I'll talk about it a little bit later, my top 10 list of health concerns. It is absolutely imperative that we get our health concerns under control. And so those would be the areas that I would concentrate on. More research for cancer, stroke, diabetes, and numerous others, immunological type of problems, and other kinds of diseases that are out there. Question number 4. What is the obligation of the United States in terms of humanitarian assistance to other countries? Absolutely, we should do everything we can to help out our countries that are abroad and our neighboring countries from a humanitarian perspective. If we can afford our own healthcare system, we can certainly extend healthcare initiatives, or at least start up programs in other countries. And so I think it is our objective as a nation to look at other countries from their growth perspective to try and help them out as best we can, as financially best as we can. But at the same time, we do need to concentrate on our own health care here at home as a high priority as well. And question number 5, as President, how will your approach possibly transform healthcare from a global perspective? Well, I believe that if this kind of approach with our healthcare approach would work, where it's kind of a combination of both approaches, I think other countries would, there again, try and model or emulate our approach. Once again, my name is Bruce Bongard, virtual presidential candidate under the Prolution Party, saying thank you for your attention and take care.